stuff together. When you get to the patient's bed, you can just verbalize.
Okay.
That's fine.
Yeah, we definitely have our proper PPE.
All right. All right, your PPE is on. You're prepared to go in the hospital. When you go in, we will be utilizing the monitor behind you as well as this monitor here so that you can actually see it on both sides. If you have any questions, feel free to ask me. Like I said, I'm here to facilitate and ask any questions. And you'll get your report from me as well.
All
right, your 10 minutes starts now.
Okay.
You're at the bedside.
Okay. So, so I know we came in with pneumonia.
Yeah, he came in with pneumonia this morning.
Okay. All right. He's had a fever with it?
Yeah, he's been like 39.2, 39.3 all morning.
Okay. All right. Have y'all given him any medicines, any breathing treatments, any?
He got some Rocephin. He got 2 grams of Rocephin. Probably about an hour ago, I guess. He got 2 grams IV.
Okay. Is he still complaining of shortness of breath for y'all? Has he got any better?
Yeah, he can talk to you. He's kind of been coughing a little worse here.
Okay.
All right, so I see you got the SAT probe on. You got the blood pressure cuff on. You want me to set that auto for you guys?
Yeah.
Blood pressure. How often do you want that?
Every 5 minutes is fine for right now.
Okay.
So I'm just gonna take a listen real quick.
All right, I'll have your blood pressure here. All right, there's your blood pressure.
So I'm gonna listen for breath sounds. I want to make sure they're equal, clear. I want to listen for any wheeze. And I want to rock out.
He's diminished bilaterally, is what you hear.
Okay. So I'm gonna go ahead. Have y'all put him on end-tidal capnography at all?
We'll just say that this cannula is now an end-tidal.
Okay.
And I'll cut on your capnography. Usually takes about 5 seconds for it to warm up here.
So I noticed he's hypertensive. So I want to start talking to him. You know, how does he feel? Is he able to talk to me right now? Is he able to?
He's as you find him.
Okay. All right. Sir, how you feeling right now? Okay, so he's not talking to me at all. Is that right?
No, it's as you find him. Yeah.
Okay, so yeah. So what we're gonna do? I don't want to lay him supine just because of his respiratory distress, but I do want to start hanging a bag. He also has some obstruction on the capnography, so I want to start giving him a duoneb treatment, 0.5 of Atrovent and 2.5 of albuterol.
Okay.
Tachycardic 134. So that's probably due to the respiratory distress.
Ron, you said fluids. How much fluids were you going to do?
So I'm gonna hang 1,000 bag right now, and I'm gonna just start bolsing it. I'm gonna start reevaluating his blood pressure.
Initiated now.
Okay.
All the doctor told me to hang. I've just got this saline going at 150.
Okay. Is he on? He's on O2 now?
Just 2 liters with the capnography.
Okay. So like I said, we want to start getting our. You said you verbalized the. All right. Like I said, we're going to give him a duoneb treatment. Go ahead and put that on him.
Okay. We'll show that in progress. Oh look, it's picking up now. It's picking up now.
The purple
SAT. Yeah.
Okay. So now his SATs are diminishing. Now they're 84%. So I'm really not comfortable with just letting him hang on the duoneb. So I'm going to start putting him on CPAP with an inline nebulizer.
Okay. You can open that up. Yeah. Go ahead. I got y'all's paperwork ready whenever you get ready. The night shift nurse gave it to me.
All right. So how much fluid going in him?
He's just been on that 150 an hour. I don't know, maybe 3 hours.
Okay. All right.
2.5, 3 hours.
So he's not. See his eyes are closed.
Your fluid bolus is finished.
Okay.
Just
finished. We can cycle.
I got this Cobra form.
All right.
Here.
I'm gonna start doing painful stimuli, sir. Can you hear me?
He's as you find him.
Do we know if he's a DNR?
No, he's a full code, and his family's already en route to Jackson.
Because he's unresponsive now, we want to start to manage his airway. First thing I'm going to do is start with the BDM.
So you tacking at 178.
You don't have to open that if you don't want to.
Yeah, sorry.
I mean, if you want to, you can.
Well, I already opened it.
Okay, that's fine.
Alright, we're going to start bagging him. I'm going to let my partner start bagging him. Alright. Check the pulse.
He has carotid pulses.
Yeah, okay. So we're going to hang another bag at this point. We're going to start getting our intubation stuff together just because this GCS is 3. say he's unresponsive completely.
Yep.
Okay. So he's gonna start bagging. Getting good chest rise and fall.
Yeah, he's got good chest rise and fall. It's got equal excursion.
Okay. His stats are still 84. Is that
Yep.
right?
Heart rate maintaining that high. You want to think about cardio break?
Yeah. Well, that's more of a. Let's see.
All right, you got the 12 right there next to you too.
Yeah. So he still has the P waves.
Yes, it looks the same, just maybe a little faster than what we had earlier.
Yeah. Okay.
All right.
That's good. I want to
He's
start
been-
doing. I want to get the airway.
Let's change up the position too. Get some Trendelenburg.
Yeah.
Try to improve
I can
the
help you
pressure.
guys put that bed down
All
there.
right.
You want him flat or do you want him in trim
Yeah,
down?
we'll aim flat for right now.
Okay.
And I just want to make sure he's still getting good chest rise and fall with his BVM. Want to check pulse again? Do I still have?
You still have carotid
Yeah,
pulse?
still have carotid pulse.
All right, I still have a bag hanging. And I don't have sats.
Yeah, it's,
Second bolus is finished.
yeah, it's been like that kind of on and off for the last
Okay.
hours.
So
Hard
when
to
we
get
do
hard to get sets.
All right, so I want to get a repeat blood pressure.
All right, can we get you a fresh one?
Okay.
All right, there you go.
Not much improvement.
That one
Yeah,
just
so
got
good
that,
down.
like-
So is he allergic to any medicines that y'all know of?
No, he as far as history goes, I don't have any allergies on him.
I'm still getting good chest rise and fall.
Yep.
You want me to prep any drugs when you come over to?
Yeah, so we start thinking about a pressure now. I've had 2 liters of fluid.
Yep.
Obviously, I don't have a change, so I'm going to start thinking about dopamine. So I'm going to start getting my partner to start spiking 400 and 250 infusion of dopamine. Do I know how much this patient weighs?
Yeah, he's 80 kilograms.
80 kilograms.
His family told us that before they left.
Rest.
You don't actually have to spike that.
Throw me a 10cc syringe,
You
please.
can just pull out the tubing in the bag and.
Do you have a history of congestive heart failure or anything like that?
Non-insulin dependent diabetic. He's supposed to be taking pills. I'm not sure if he's really taking them or not.
Okay.
And he smokes like half a pack a day. I think
Yeah.
he was telling us. He walked in.
Alright. So we get that. So I'm going to start working on the airway. I definitely want to pay an airway because it's GCS. I want him to start working on the pressor since it didn't have any change after 2 liters.
Okay. Set the dopamine, or spike the dopamine.
He's
Alright,
gagging.
so he's starting to gag.
Yeah, he's gagging pretty bad.
Alright, so let's go ahead and continue to bag. Am I still getting good chest rise and fall with
Yes.
the BVM? Okay.
Yes.
Alright, so I'm going to hand this off to him.
What dose did you use your dopamine at?
So I want to start off about 5 mics per kilogram. So he's 80, so it'll be
85 kilogram wax per kg. I got a calculator on phone if you want to do that.
Do y'all know how much he weighs in pounds?
Yeah,
It's 80.
that's fine.
That's fine.
Okay.
That's good
Okay.
enough. We'll take that. Yeah.
All right. So I want to start there.
Okay.
I'm going to let that start running. So I'm going to be. Let's recycle his pressure.
All right, I got you one cycling right now. I got
Okay,
your
so it's still
dopamine
cycling.
running on the pump.
All right. So he's still satting at 84%.
Yeah.
Okay. So
Hit
what?
it again, Paul.
All right. There's your fresh blood pressure.
All right, so I'm going to maintain my current infusion. The dopamine, obviously, it's having an effect. We still set an 84%. He's still unresponsive, is that right?
Yeah, he's unresponsive.
Okay. We said, does he still have a gag reflex?
Yeah, he does.
He does. Okay. All right, and we have. Let's see. I didn't say we'd hook our BBM up to high flow too.
Yep. Okay.
Okay. All right. So now we're gonna get the pads on.
All right. We have them pre-done for you guys.
All right.
Right
So
here.
he's in VTAC. All right. Do I have a pulse with this?
You do have a pulse.
You do have a pulse.
Okay. So I want to synchronize cardio for her.
They would have 2
joules.
That's what you would do.
Okay. So I've got my pads hooked up. First thing I want to do is hit the sync button. So hit that.
Time.
Nice job, guys.
All right.
Good job, fellas.
Oops, I turned it off.
That's all right.
That's fine.
Just don't shock me.
You're the last group. Excellent job.
Nice job.
Thank you.
What'd you think?
I thought it was good. You know, obviously he deteriorated pretty quickly, so the treatments that we really wanted to perform as far as handling that, so when I started listening to him towards the end, he had the audible wheeze, not so much at first, but the CPAP, I think if he could have maintained a little bit better, I think would have been extremely beneficial for him, especially with that inline nebulizer.
Well, without the CPAP, we still had positive pressure. Ventilation's going on, trying to go away from some of his respirations.
So obviously his pressure drop